So hospitals were scary places in 2020. Um, I was the only patient I could see in the oncology waiting room or the surgeon's waiting room. It all felt quite scary, real, and the only information I was given was um, I'm very sorry to tell you that I think you do have um, a tumour. That was after a physical examination, but you need to have a scan, CT scan, follow up. I was given the details of what a CT scan involved, but and I think this is a bit of a theme that runs through all communications: is you stop listening, because I'd gone from thinking this is nothing to all of a sudden being very scared. And when you're very scared and frightened, you don't hear anything. And literally the only bit I remember is being told that conversation carried on for a while after that. And my wife was waiting for me in the St George's car park. And I remember just bursting into tears. And I don't remember a lot of what was said to me. Really don't. I don't think I've met a healthcare professional who wasn't supportive or kind. I think they're let down by systems at times. And the worst things that I think happen to people like me are you go along for a scan result and nobody's looked at the scan or the scan report isn't ready. And I think people deny this, but there's an underestimation of how stressful waiting for scans is. And I think there's an underestimation of how scared and frightened you as a patient can be, um, and how alien the whole thing is, and how little information you take on. I didn't even realise till months afterwards that I had a terminal diagnosis, even though it was given to me in writing. I hadn't realised. So, presenting information is no guarantee that people actually understand it. Um, I think there's don't over or underestimate your patient, because um, I think people would see me, and if they knew anything about me, would think he's going to understand all this information. It's not going to be. I didn't, and I was absolutely freaked out by it. But I'd know, obviously. So don't just assume because you said something to someone, or give them a leaflet, or send them a letter, that they understand what's going on. Um, we don't. Um, and when you're ill, organising stuff can be quite difficult if you're feeling really awful. Then just the sheer scheduling of stuff in your diary can be quite difficult. I think the comms bit's certainly improved from someone who'd hardly ever been sick before to now. The I'm 99% convinced all my letters are in one safe place online now, so I can access them. Meetings are still. I still don't know why I get letters and um, an alert from the portal that says I've got an appointment. Seems like a whole waste of time and effort getting duplicated messages, um, information. They'll let us be improving a bit. Because I think, apart from comms being the medium and the message, or IT, there's also the IT that we as patients use that's outside the NHS. So, for example, we all Google. We're all told not to, but we all Google. We use AI increasingly. So for example, I get letters from my oncologist. It used to be a bit of a bugbear for me because I used to get letters from oncologists or other healthcare professionals and literally not understand what they were saying. So I just feed them into ChatGPT and it comes out as plain English. Not quite sure why that can't be done in the first place, but that's the sort of views of IT. I was overwhelmed with how kind people were, which um, which is a bit scary in itself because you realise how ill you are. If that doesn't sound too perverse. Um, but I was genuinely grateful, still am every day, and for how kind and nice people are and were, still are.